Before we start today's webinar, there would continue from where we left the last two webinars. We are going to discuss today about the principles of diagnosis based on the doshas. In the next webinar, we will complete this topic with the principles of treatment. So, we are going to first of all discuss about some concepts that are very important in making diagnostic decisions. And the dosha cycles, which we may have touched upon briefly, needs further elaboration to enable us to develop diagnostic protocols. So the doshas are extremely fluid and fluctuating. So even when they are in balance, they don't remain stable. So the most fundamental dosha cycles is the increase, decrease, and normals. Doshas keep increasing, decreasing, and by coming back to the center. And what's important is that even the increase and decrease within limits are considered to be normal. So this is the first point that we have to understand, that it is normal for doshas to increase, decrease, and then come back in between the state. So this point is very important because in Ayurveda, one of the most important elements of diagnosis is understanding the imbalance of the doshas. So one needs to be fully aware of the normal doshic cycle in terms of increase and decrease, so that we understand the parameters on the basis of which we can say when the doshas have increased beyond a certain limit or decreased beyond a certain limit, then it becomes abnormal. So here is the normal cycle of the doshas. They keep increasing and decreasing as the day and night passes, as the seasons pass. And these increases and decreases cannot be considered as pathological. For example, increase of vata in the late evening, early morning, rainy season, old age, and the last stage of digestion is actually normal. We cannot consider this as abnormal. An increase of pitta in the middle of the day, the middle of the night, autumn, middle age, and in the middle of digestion is again normal. So it means that in all these conditions, doshas increase normal. So also, increase of kapha and first part of the night, spring, young age, and at the beginning of digestion. This is also part of the normal process of dosha cycle. So we can consider doshas to create problems or disease only when they go beyond this normal cycle of increase, decrease, and balance. So let us look at that. But before that, we also need to understand many more fundamental concepts about the normal movements and cycles of doshas. So here is how the doshas naturally increase and decrease during the day and night. And you can see here that kapha decreases as the day progresses. See, kapha decreasing. Pitta increases around the middle of the day and then falls back again. And vata increases as the day progresses. So kapha decreases, pitta increases and decreases, and vata increases. This is the natural cycle of the doshas. So if any of the doshas increase or decrease other than at these times, other than in this pattern, then we would consider that as abnormal. Otherwise, it's perfectly normal for the doshas to fluctuate in this manner. So this is a brief overview of the diurnal variations of doshas. So I hope this point is clear. What we are trying to discuss now is the normal versus the abnormal increase and decrease of the doshas. So there are two cycles for the doshas, the normal and the abnormal. So in the normal, the doshas increase, decrease, and then again finds balance. Whereas in the abnormal cycle, when the doshas increase, instead of decreasing or balancing, they get vitiated, or they get deranged, and then they spread, they localize, and they manifest as disease and create complications. So this is what makes normal physiology and pathology different. In normal physiology, the doshas, although they increase and decrease, they recover their balance. Whereas in pathology, doshas increase, they don't recover their balance, but instead they get derailed, they spread to different parts of the body, they localize in specific organs or tissues, then cause the manifestation of disease, and then eventually, not treated, they lead to complications. So there's another important concept which we may have to dwell upon for some time to be fully understand. And these are the three zones or pathways of disease. Three zones are otherwise called as pathways of disease. In Sanskrit, they are called as the Roga Margas. Roga meaning disease, and Marga meaning pathway. So there are three such pathways, and we will discuss a little bit more about that. So the first one consists of the alimentary tract, which is actually the one that connects with the external world. It is this pathway which allows substances from the outside world to enter into our body. And this is also known as the inner pathway or the inner zone or the manifestation of diseases. This extends from the mouth to the rectum and represents the input, process, output that is so essential for life to subsist. The second pathway consists of all the channels of circulation. arteries, the veins, the lymphatics, all else that distributes the digested food to the rest of the body and also returns the waste products that result from metabolism. So this zone or pathway is called as the outer pathway of disease, or it can also be called as the outer zone for manifestation of diseases. In Sanskrit, the inner zone is known as Koshta or Abhyantara Marga, which translates as the alimentary tract or the inner pathway, of the disease. The third one is the innermost, it is the central portion or the middle zone, central zone of the body, which includes all the vital organs. The zone of the vital organs, which has extremely restricted access to the body. This is sometimes called as a middle or central zone, or the middle or central pathway of diseases. So this is actually very, very important to understand. Because to understand the disease process and to be able to diagnose diseases, you must be very familiar with these three zones of disease. So here's a summary of what we discussed now. The inner zone represents the alimentary tract. The outer zone, the pathos and the channels, and the middle zone, the vital organs. So these three zones serve as the platform on which diseases manifest. So the doshas keep moving across these zones, and their movements determine the manner in which diseases manifest. So we will discuss a little bit more about the movement of doshas through these zones. There is a continuous circulatory movement of doshas. Doshas move from the inner zone to outer zone, then the middle zone, vice versa in cycles. Which means when we eat food, at first doshas are secreted in the alimentary tract, so the inner zone, and then it moves along with the digestive food to the outer zone. Then from the outer zone, it moves into the central zone of the vital organs. So this is a triangular movement. It keeps happening day in and day out. There are certain factors which activate or switch the movement of the doshas. Exercise, increase of digestive fire, unhealthy lifestyle, hyperactivation of water causes doshas to move from the inner zone to outer zones. So if we exercise much, then there is a movement of doshas way inner zone. When digestion is very strong, also this happens. Unhealthy lifestyle also causes the doshas to move from inner, the outer zone, and then to the middle zone. Okay, I will try to refresh my page. Okay. So we are talking about the movement of doshas from the inner to the outer zone and then the middle zone, and vice versa. As I was mentioning, when we do a lot of exercise, when there's increase in digestive fire, or if you follow a very healthy lifestyle, and if there is hyperactivation, the doshas move from inner to outer. On the other hand, opening of the channels, an increase, accumulation of doshas, overflow of doshas, or separation, cooking of the doshas, and pacification of the doshas cause the pacification of water causes the doshas to return to the. So doshas are moving from inner to outer. Hello, is it clear? Hello? 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 Okay. So as I was again talking about the circulatory movement of the doshas move from the inner zone, which is the alimentary tract, out to the rectum, and then the outer zone, which consists of the channels, the circulatory channels, and then the middle or central zone, which consists of the vital organs. So exercise, increase of digestive fire, unhealthy lifestyle, and hyperactivation of water causes doshas to move from inner zone to the outer zones. And on the other hand, when the channels are open and when there is an increase or overflow and cooking of the doshas, and when vata is specified, then doshas return to the inner zone. So diseases become more active when the doshas move from the inner zone to the outer or middle zones, and diseases become milder when the doshas return from the middle or outer zone back to the inner zone. So it's this is very important in diagnosing diseases. We try to assess what is the trend of the movement of the doshas, whether it is moving the inner to the outer or middle, or from middle and outer to the inner. In fact, one of the goals of therapeutics is to reverse the movement of the doshas from the middle and outer zone back to the inner zone. So this is why in Ayurveda we say that rest is important. Diseases and simply resting can cause clinical improvement, because when we take rest, vata is specified, and so the doshas return to the inner zone. And when the doshas are back in the inner zone, it's easy to remove them from the body. So it's important to do rest when we are doing treatments. And when Ayurvedic therapies are performed, we should not activate Vata. If Vata becomes activated, then all the doshas will move from the inner zone to the outer and middle zones, thereby aggravating the disease. Whereas when we take rest, the doshas come back. So this is a very important point for and need to make assessment the movement of the doshas through the inner, middle, and outer zones. So since this is such a very important concept in Ayurveda, I would like to, maybe some of you joined also a little later, I would like to just clarify whether you were able to get this concept, but a little more explanation. Is this clear to everyone? Hello? Hello? Hello, is it clear now? Hello? So I was just asking whether what we discussed, I was asking whether what we discussed is clear. Whether you need a little bit more explanation about the three zones of manifestation of disease. The doshas move continuously from the inner to the outer and middle zones, and they return from the middle and outer back to the inner zone. And the return of the doshas back to the inner zone helps in the healing process. It reduces the symptoms of the disease, whereas the movement of the doshas from the inner zone to the outer and middle zones actually cause aggravation of disease. Please do let me know if you need any clarifications. So in the previous class, we discussed about 62 types of doshic imbalances. And now we will have a quick overview of this imbalances with the help of a table. I hope all of you are able to see the table. Is it clear? There are 63 basic types of doshic combinations, and one of them is responsible for health, and 62 of them are responsible for disease. So we will look at the 62 types. There are 25 types of increase of the doshas. So this is what is mentioned in the table here. Please do let me know if any of this is not clear. So when there is a single dosha increase, there can be a condition in which vata is increased, pitta is increased, and kapha is increased. This makes it 3 types of issues. And then we have 9 types of dual combinations. Vata and pitta increased equally, pitta and kapha increased equally, and vata and kapha increased equally. So this makes it 3 types. And then we have vata increased, pitta increased more than vata, kapha increased more than pitta, kapha increased more than vata. And then we have vata increased more than pitta, pitta increased more than kapha, and vata increased more than. So we have 9 possible such combinations of the dual doshas. So this makes it actually 12. Then we have the triple dosha combinations, and we can look at these possibilities. One is when Vata, Pitta and Kapha are increased equally. Then we have Kapha slight increased, Vata increased more. Vata Pitta increased more. This is in dual combinations. Pitta increased and Vata Kapha increased more. Vata increased and Pitta Kapha increased more. And then Vata Pitta increased and Kapha increased more. Vata Kapha increased and Pitta increased more. Pitta Kapha increased and Vata increased more. So these are just mathematical combinations, and once you understand the logic, you will be able to derive them yourself. And then you have another 6 gradient increase. Vata increased by 1 degree, Pitta by 2 degrees, and Kapha by 3 degrees. Vata 1 degree, Kapha 2 degrees, Pitta 3 degrees. Pitta 1 degree, Kapha 2 degrees, and Vata 3 degrees. And then Pitta 1 degree, Vata 2 degrees, and Kapha 3 degrees. Kapha 1, Vata 2, Pitta 3, Kapha 1, Pitta 2, and Vata 3. So in this way, we get again another 13 triple dosha combinations for increase. Thus, there are 25 basic ways in which doshas can increase and combine with each other. So this is the comprehensive, complete table for the dosha increase. Is this table clear? Is the logic clear? You want any further explanation? Okay, thank you. So then we will look at the next slide, which lists the dosha decrease, which is exactly the same, another 25 types when doshas decrease. Vata is decreased, Pitta is decreased, or Kapha is decreased. Vata and Pitta decreased equally, Pitta and Kapha decreased equally, and Vata and Kapha decreased equally. Pitta decreases more than Vata, Kapha decreases more than Vata, and Kapha decreases more than Pitta. And then Vata decreasing more than Pitta, Pitta decreasing more than Kapha, and Vata decreasing more than Kapha. So this again makes it 9 plus 1, 3, 12 combinations. And then we have the triple dosha, 13 combinations, just as we mentioned in the case of increase. One category is all the 3 increased together, and then one single dosha increased with the 2 other doshas extremely increased. So we have Kapha, Vata, Kapha less and Vata Pitta more, so Kapha less and Vata Pitta even more less. Pitta is decreased and Vata Kapha is even more decreased. Vata is decreased, Pitta Kapha is even more decreased, and so on and so forth. So we have 25 again combinations of dosha decrease with another 25 dosha increase. So totally it makes 50 such combinations. So we have explained 50 combinations of dosha increase and dosha decrease. So what we have been discussing so far is that doshas increase and decrease and balance themselves. So to a certain extent, their increase and decrease come within the gambit of normal physiology. We cannot consider this as a disease. But when they increase and decrease beyond their normal limits, then this lays the foundation for all pathological manifestations in the human body. So when we diagnose doshic imbalance, it's important to look at all the mathematical possibilities of how the doshas can combine and become deranged. So of this, there are 62 possibilities of pathological combinations, and one possibility of physiological normal combination. And now we have 25 combinations of dosha increase and 25 combinations of dosha decrease. So I hope this is clear. I hope that if there's any clarifications you would ask in between. So I'm going ahead to the next slide, which is the remaining 10. So we have 9 more imbalances in which doshas are both increased and decreased in various combinations. And then we have the ultimate dosha balance, which is the 63rd, which actually is responsible for health. So the triple dosha plus minus combinations are about 12. So vata increased, pitta and kapha decreased. Pitta increased, vata and kapha decreased. Kapha increased and pitta and vata decreased. And then we have kapha increased and vata and pitta decreased. Vata increased and kapha and pitta decreased. Pitta increased and kapha increased. Vata increased, pitta and vata decreased and pitta and kapha increased. Pitta decreased and vata and kapha increased. Kapha decreased and vata and pitta increased. Vata decreased and vata pitta decreased and kapha increased. Pitta kapha decreased and vata increased. Vata kapha decreased, pitta increased. So in this way, we have another 12 combinations. So 50 plus 12 makes 62. And then the last one is the dosha balance. This is the 63rd. So now we have seen all the possible basic 62 types of pathological combinations. I hope this is clear. Can we move on to the next topic? So now we will discuss about disease. So what is disease? According to Ayurveda, disease happens when the imbalance of the dosha affects a particular dhatu. So which means 62 combinations of the doshas can affect each dhatu. So since there are 7 dhatus, in principle, it is possible for all the dhatus to get deranged under the 62 imbalances of the doshas. So each dhatu can potentially be deranged in 62 different ways. So if you were to multiply 62 into 7, that is the total number of basic diseases, basic ways in which the human body can become deranged. That's about 434 basic disease pathways when we consider the 7 dhatus. So when we transpose the 62 basic doshic pathologies on each dhatu, then that's how we get 434 basic diseases. Is this logic clear? Okay, thank you. So we move forward again. Now I want to discuss about how that begins to manifest. The disease manifests in stages. The doshas become imbalanced and then the dhatus get affected. And then the symptoms of the disease manifest. So this Ayurveda says happens in 6 stages. These are the stages of the disease. These are sometimes called as Kriya Kala. Kriya Kala means opportunity for treatment. So Ayurveda believes in very early diagnosis of the disease and early treatment to prevent progression and and also complications. So 6 stages or 6 opportunities as the disease evolves. So the first stage is the stage of increase, in which the doshas go out of balance, as we discussed 62 different ways. And as the doshas increase, as we discussed earlier, just simply an increase is not disease. The doshas need to increase in such a way that they cross the limit, they cross the threshold level. When they cross the threshold level, then they become aggravated. Now they are capable of causing disease. In the third stage, this imbalance shifts across the body because that imbalance needs to localize in a specific area for the disease to manifest. And after shifting or spreading across the body, that imbalance gets localized in a particular dhatu. And that stage is called as localization. And once the dosha is localized, I mean, they manifest through a particular dhatu. And then comes the manifestation of the disease. So it is only in the 5th stage that we actually see or experience the disease. And this is where Ayurveda emphasized that we are able to diagnose the disease earlier. We actually miss 4 stages of the disease, where we could have treated the problem much more easily without causing severe damage to the body. But unfortunately, most of the time, we are able to diagnose the disease only when it reaches the stage of manifestation, of clear manifestation of the disease. So when the disease has completely manifested, we begin to experience the symptoms, and we're able to clearly diagnose the disease. And then the last stage of the disease is the stage of complications. So this is the stage in which the disease develops into something which is incurable, which defies medicinal treatments and causes complications that can be life-threatening, or they can cause severe disabilities or deformities. So these are the stages of disease. So we now looked at how the doshas go into imbalance, how they keep fluctuating, how they derange dhatus in the process of creating disease. And the next point that we have to discuss about is the formation of ama. And now it also influences the formation of stages of healing and disease development. So in the process of development of the disease itself is the seed for healing. So we can look at it in 2 ways, either as a breakdown of the body, either as a disease process, or we can also consider it as opportunity for treatment and consider it as the attempt of the body to recover stability and restore health. So in Ayurveda, 2 important other stages need to be considered while diagnosing a disease. And this is called as the ama and nirama. Have you all heard of ama? Has anybody heard of ama? Okay, so ama is a very, very important concept in pathology or the development of diseases. When the body ingests substances from outside, it is digested and absorbed, and the process, the unnecessary component, is eliminated as waste. Ama is not exactly toxin. ama is improperly processed nutrients, food, or any other substance that we have consumed. So the most important thing is that ama is something which has been improperly processed. The body has not completed its digestion or metabolism. So it is kind of half cooked. So the actual meaning of the word ama is half cooked. So what happens when such half-cooked substances circulate in the body? When half-cooked substances circulate in the body cannot absorb them or assimilate them completely, nor can the body actually remove them. That is the problem with ama. Ama is something which we cannot assimilate. Yes, but it doesn't acquire. It's wrong to say it as toxin. It's called toxin only at a later stage, that is ama visha. It can turn into a toxin. As the disease progresses. So there's a separate term for ama visha. So in very advanced stages, this ama can turn toxic, because the word toxic is to be used very carefully. And when you say there is a toxin in the body, it means it poses a threat to life. It can interfere with our vital functions. Only then we need to consider it as a toxin. So Ayurveda differentiates ordinary ama from ama visha. So, but ama also lays the foundation for the disease process. These improperly cooked substances circulate in the body and they form conjugates with other substances and then eventually cause blockage in the channels, can cause oxidative damage, it can affect various vital organs. All this happens when the ama circulates in the body. So usually in the beginning stage of disease, there is ama in the body. In this stage, the digestion is weak, the channels are congested, and the disease is in an acute stage. So in the first stage of full-blown manifestation of the disease, which Ayurveda calls as the stage of ama, and in that stage, the disease is acute, the digestion is weak, the channels are congested. And here we need to do things that can cook the ama completely. So when the ama is cooked and transformed, then the severity of the disease will come down. So this is a fundamental principle in Ayurveda. We know now that the imbalance of the doshas is what causes disease. But before we can even set right the imbalance, before we can bring back balance to the doshas, it's very important for us to deal with ama. Doshas can be balanced only after ama has been taken care of. So in all Ayurvedic diseases in the first stage, we use digestives and what we call as ama pachana or ama agni. These kind of treatments or interventions are applied to ensure that the ama is eliminated. And after that, we go for pacification of the dosha, strengthening the tissues, and so on and so forth, and restoring health. So as in the later stages of disease, when much of this ama has is usually very chronic diseases. Ama is gradually digested by the body. In this stage, the digestion improves a bit, channels are comparatively clear, and the disease now becomes very chronic. And in this stage, we consider it as nirama. So in the early phase of every disease, the dhatus are relatively strong. The dhatus have more strength in the first stage of the disease. Whereas in the later phase of the disease, as it progresses, the dhatus actually become weak. So these are two stages of disease that anything that goes into the body can be turned into However, I want to clarify that ama does not always, dharma doesn't mean food. When food is not digested, the condition is called indigestion, not ama. So it's important to realize that indigestion is not ama. Indigestion is temporary. Like if you take some measures, the digestion can be completed. But ama here means improperly formed rasadhatu. So it's more than food. It's beyond the stage of food. So indigestion is not ama. Though indigestion can eventually maybe produce ama, indigestion by itself is not ama. And indigestion can be dealt with by simple herbs, by proper lifestyle, changing body routines, whereas ama will need systematic treatment. So this is the difference between ama and indigestion. And so all diseases go through these two stages. In the first stage, in the acute stage, we say there is ama in the system, and in the more chronic stage, when it becomes nira, then the disease doesn't manifest in such an acute manner anymore. These 2 points are very crucial when we assess, try to diagnose a patient. We must really try to understand what stage of the disease is the patient presenting himself or herself. Is it in the stage of ama or in the stage of nira? So I hope this point is clear. As I mentioned, I expect to get some feedback or questions if things are not so clear. Okay, so we move forward. Now we will look at, so we have so far now discussed about a very important concept in Ayurvedic diagnostics. And this is about the doshic imbalances and how the doshas manifest through the dhatus to create more than 400 pathological combinations. And now we will study how Ayurveda advises to examine and diagnose a disease. So in Ayurvedic diagnosis, there are actually two components which I have not mentioned in the slide, but I will explain that we have what is called as Rogi Pariksha, which means examination of the disease. This is Roga Pariksha. So one is we have to assess the disease, and the second aspect is that we have to assess the patient. So Ayurvedic diagnostics consists of these two broad approaches. One is, so we will be discussing what are the tools that Ayurveda describes to actually do the diagnosis. So we need to study the disease as well as the patient. And so some of the tools that we use, one is pratyaksha, this is called as direct perception. And the anumana is inference, perception aided inference. So we can know the clinical approach is very much emphasized in Ayurveda. In order to diagnose and understand a disease, we need to actually examine the patient and also refer to textual knowledge to draw inferences. So in this way, Ayurvedic approach to diagnosis is really very rational. Rational in the sense that, it's based on actual examination or observation and perception aided inference. So clinical examination is really very, very important in Ayurveda. And Ayurvedic texts make it explicit that it's not possible to become an adept in diagnostics by just reading some textbooks. So while we can always rely on direct perception and perception-aided inference, these two tools may also turn out to be not completely helpful in arriving at a diagnostics. In fact, the more equipped we are with the background knowledge of the disease, the more effectively we will be able to use our senses and mind to draw conclusions on disease. And so that third component, which also we need to know to make our diagnostics effective, and that is called as Aptopadesha or expert opinion or accumulated knowledge. So actually speaking, Ayurveda advocates these three methods broadly. We will also look at more specific tools that Ayurveda has advised. But very broadly, we can say that there are three things that you have to directly perceive, you have to inspect, you have to palpate, you have to hear, and you have to indirectly also use your taste perception to know about certain diseases or doshas. And then you also have to smell. So these are, you have to use all your sense organs to get inputs from the patient so that we are able to build a picture of the disease which is comprehensive. So this is the threefold approach. If you also have expert opinion, if you have prior knowledge about how what is the presentation of the disease, how does it evolve, what is the pathogenesis, what are the symptoms, which organs are included, which are the tests that we need to be able to diagnose a particular disease. All this background knowledge is known as Aptopadesha or expert opinion. So the method of Ayurvedic diagnostics is to first of all get an understanding of the disease by reading the texts. and then applying them in actual clinical or live human situations. And there we are on our own. We cannot say that the text is writing this or text is mentioning this. We need to be able to apply and try out many of the treatments that are mentioned in the texts. And this is called as Aptopadesha or expert opinion. So all these three things together make up the package in Ayurveda for diagnostics. So then we have another point of view is the threefold approach. It's called as the Darshana, the Sparshana, and the Prasna. So the Darshana is actually the visual examination, both aided and unaided. So these are the sequence in which an Ayurvedic physician examines a patient for diagnosis. So you can see now we are coming to, as I mentioned earlier, we have two steps in diagnosis. One is the examination of the patient and the other is the examination of the. So we are continuing again with the examination of the patient. So in Ayurveda, you can see these are empirical methods and these are further and further elaborated. Ayurveda emphasizes on visual examination of the patient and then, tactile touch methods, which includes also the pulse examination, and then questioning or prashna or interrogation. So I'm mentioning this here especially because when people study the pulse diagnosis, a lot of patients also expect that the Ayurvedic physician is expected to just read the pulse and then tell everything about the disease and the patient. So you can see that this is not the way the Ayurvedic texts have approached diagnosis. That's why I'm elaborating these concepts here. That you have to have direct perception, you have to use inference, you have to use textual knowledge, you have to do also questioning. So nowhere in any of the Ayurvedic texts it has been mentioned that just by touching the pulse, you can diagnose everything about the patient. So this is a very important aspect. Pulse is just one of the inputs that is needed or that will be helpful in arriving at a diagnosis. So I hope that point is clear, that Ayurveda really emphasizes on other methods also of examination, and that it's not completely, exclusively one method oriented, or nowhere has it been mentioned that just by examining the pulse you can know everything you need to know about a patient. So let's look at even more methods. So to study the disease, I'm sorry, there's a little bit of Spanish here, but the English is still there, so I hope you can read this. So there's also the fivefold approach to study disease, that when you study a disease, you need to understand its causes, which is called as etiology. What are the causes that trigger the disease? And what are the premonitory or prodromal symptoms? And then what are the symptoms? And then, in Ayurveda, there is also the test dose response, which is called as upashaya. And what happens when you give a test dose of medicine? If the patient responds, then we can be sure that our diagnosis is correct. In other words, a trial treatment was also done to confirm the diagnosis. I hope this is clear. So we need to study the causes of the disease. We need to study the prodromal symptoms. And then we need to study the symptoms, signs and symptoms of the disease. And then the test dose response. And then finally build the pathogenesis. How from the cause to the final manifestation of the disease, how the disease evolves. So this is a very interesting concept in Ayurveda, that the disease is considered as something that evolves in time, and which evolves and which progresses in stages, and which demonstrates a cause and effect relationship. So these are very rational concepts in Ayurveda. So when there is a cause, then it produces some effects, and then you can see the premonitory signs, the impending signs of disease, and then as the cause begins to derange the human body, then we see the full-blown symptoms of the disease. And to understand whether our diagnosis is correct, Ayurveda advises to give a test dose, and if there's a positive response to the test dose, then we confirm the diagnosis, and then we build up all this process together, all these links together, and we get a complete understanding of the pathogenesis of the disease. So this is called as the Fivefold Approach to diagnosis of a disease. So I hope we distinguished clearly between the examination of the patient and the examination of the disease. And you can see that there are different methods from different viewpoints that have been explained in the classical Ayurvedic texts to make the process of diagnosis as comprehensive as possible. Do you have any questions here? Yeah, this means the initial signs of a disease. A mild symptoms seen before the disease actually manifests. Is that clear? So, so this is from this. It's very, very clear that diagnosing a disease is actually a kind of detective work in Ayurveda. So it's not a mystical thing that you just look at the patient and you know what the disease is, or you just hold the pulse and you know everything about the patient. That's not the method described in Ayurveda. Ayurvedic texts really take pains to elaborate a systematic approach to understanding disease, which includes observation, inference, which involves studying the disease stage by stage, and then arriving at a comprehensive diagnosis. So a very complete workup is needed to diagnose a disease. Now we can see when you examine a patient, again you can see that pulse diagnosis is one part of the whole process. So you can see it's the first and perhaps one of the most important aspects of diagnosis. So we first examine the pulse, and then we examine the urine, and then the fecus, then the tongue, then the appearance of the patient, then the touch, then the eyes, and then the body build. So these were called as the eightfold approach, parameters to we checked to arrive at a diagnosis. So in Sanskrit, this was called as Ashtasthana Pariksha, examination of 8 locations. Yes, examination of the eyes was part of the ancient method of diagnosis. So also tongue examination was very advanced. Different parts or areas of the tongue were analyzed very systematically to understand what is going on inside the body. We also had very specialized methods of urine examination. For example, there's something called as the oil drop examination of urine. But it is beyond the scope of our present webinar to go into the details of these different methods of diagnostics, because that needs another webinar in itself. So the oil drop examination is done to collect the urine of the patient and then put a drop of oil, and by studying the way the oil disperses in the urine, we decide what type of dosha is involved and what is the prognosis of the disease. So in this way, many methods, specialized methods of examining these 8 parameters were developed in ancient times. The fecus was also observed for color and how it, floats, or whether it sinks in water. And so there were different methods to also analyze the fecus to understand what was going on inside the body. And as I was mentioning, when it comes to the tongue, there are very elaborate methods of diagnostics mentioned. A very simple thing, like if the tongue is coated, then there is ama. So if the tongue is not coated, then the ama has been cleared from the system. So this is a very basic kind of examination of the tongue that was done in actual clinical practice. And then we have the rupam, or appearance of the patient, the gait, the orientation, and all these things, which also gave a clear understanding about the manifestation of specific diseases and imbalances. And then also the touch, whether the patient is cold to touch or whether it's warm to touch. And then when it comes to eyes, again, a lot of detailed examinations were done. Much of this has not been written down in the texts, but were actually passed on through the oral tradition. The eyes was used to understand the level of ojas in the body. I hope all of you remember our discussion about ojas. Ojas is the essence of all the dhatus in the body. So it is that which bestows strength and immunity. And according to Ayurveda, by examination of the eyes, we can understand what is the level of ojas in a particular, in the in a particular person, in a particular individual. And then comes Akriti, or body build, because unfortunately, no. Ancient manuscripts rarely have drawings. There are just a few manuscripts in the world. One was found from Nepal, which actually gives some rough anatomical drawings of the human body. But this is really very rare. Most of the classical manuscripts are in written form. Yes. So we will need to actually see some traditional experts. These are also no longer taught in the Ayurvedic institutions. This knowledge is lost to a great extent. But you can see these 8 parts or 8 parameters were considered very important to be able to arrive at a proper diagnosis of a disease. Then comes the Tenfold Approach. So you can see here again different approaches being mentioned, because this is also an important point, that the body is so complicated that it's very difficult to understand disease through just one single approach. You need to try different approaches to comprehensively understand a disease. And that's why different methods have been elaborated. And so now there is these 10 parameters which are again emphasized to be able to arrive at a complete diagnosis. So even those 8-fold method may not be completely sufficient. And these are the 8. One is constitution. So we have to assess why are we doing the observations? When we ask questions, we inspect and we palpate, and the goal of all these investigations should be to understand these 10 parameters, these 10 important factors. So one is constitution. And then pathology. We need to understand both the balance of the doshas in the constitution as well as their imbalance in pathology. Because in some people, the doshas may be imbalanced as part of the constitution itself. And so it's very important to know whether the imbalance that we are encountering is part of the constitution or is it part of the disease. And so that is why the constitution has been differentiated. It's important, it's been highlighted that we need to study and differentiate between the normal balance, the normal configuration of doshas in Prakriti and their imbalance in disease. And then we need to study, there's a very elaborate method mentioned for assessing the quality of the dhatus or the tissues. So after studying the dosha, go to the dhatu. So we have 7 dhatus as we discussed, and the dhatu sara means the quality of the tissues. We need to study in some people, just like doshas dominate, this is a very important clinical aspect. Just like in some people, there is dominance of a particular dosha. In some people, there is also dominance of a particular dhatu. So in some people, dhatus dominate and they create specific characteristics. So these are not called as dhatu prakritis, but they are called as dhatu sara. I don't know whether you have heard how dhatus can shape a person's features. Have you heard of this? Like some people can be dominant some people have rasa dhatu dominance, and they exhibit certain specific characteristics. Some people have rakta dhatu dominance, and they look a bit different from others. Even though two people may have the same dosha prakriti, they may look different because they have the dominance of a particular dhatu. And especially if you look at people who are athletes, they have asti dhatu dominance, means the bone. So people who have asti dhatu dominance are athletic. People who have medo dhatu dominance, they generally have more fat in their system. So we know, just like doshas, the dhatus can also be underdeveloped or overdeveloped. I can show in the next webinar, because now I do not have them, because I will show pictures of constitution of dosha and also dominance of dhatu. I'll do that in the next class. Yeah, but this is clinically very important that we distinguish between normal constitution, temporary imbalance of the doshas, and the dominance of the dhatus. So in some people, certain dhatus show preponderance, and then they become suitable for certain kind of activities, and they also develop some special skills. And so we can have all these 7 dhatus. So this is the third parameter. And then we look at the body architecture. The body architecture is in terms of the normal formation of the body organs, whether all organs are formed properly. We know that many people have defects in their organs at birth, and this can lead to many problems. So whether the organs have all been formed properly, like we know we have people who have hole in the heart, the atrioseptal defect to the ventricular septal defect. Some people have problems with their chest. They have a pigeon's chest, or some people their uterus is anteverted. So in this way, when we understand the body architecture, whether the body is all formed well, then also we understand certain susceptibilities to diseases, and we also understand whether such defects are the basis for some diseases. So that's why it's important to study body architecture. And then in Ayurveda, we say we have to quantify the body elements. elements, the fluids, the liquids. We have to measure. So this is something which we, like, it's very similar to doing a USG scan, for example, or looking at a blood report and measuring whether the WBCs are in the normal range, or seeing whether the kidneys measure normal or the liver measures normal. All this comes under the category of quantification of the body elements. So first we look for defects in the body architecture, and then we look for quantification of the body elements, including the fluids. In fact, in Ayurveda, the quantity of the various fluids of the body have been described. And in this area, we can also look at some inputs from modern lab tests. Investigations can help us to also measure the body elements. And Ayurveda also talks about proportion of the various body parts. What should be the leg to trunk proportion, the hand to trunk proportion, how the head region and the torso, the trunk of the body, how should it be? What is the ideal proportion to the limbs, the lower and upper limbs? So these kind of proportions are also mentioned. So this is again the main point of my discussion here today about diagnostics, is to show how complex and how comprehensive the Ayurvedic approach to diagnosis is. It's not a simple one-step method. There's no easy way to find out what's wrong with the human body. You need to look at multiple parameters. You need to approach in a very systematic and elaborate way to be able to really understand what's going on inside. And I think at this point, we will take a break for 10 minutes and then come back for the second session. Yes, the VedaPulse helps in assessing the dosha and some other parameters that makes our clinical work simpler and gives indicative directions. Hello. Hello. Okay, so we will continue. After the break, there was a temporary loss of connection. It took a while to log in back again, so I'm sorry for that delay of a few minutes. So we will continue with our discussion. So we were talking about the tenfold approach in diagnostics. So I want to say that I'm discussing all this to enable us to make better use of instruments like VedaPulse. So VedaPulse, along with good diagnostic skills, can make our process of diagnosis much more efficient. If we rely only on one element, then the diagnosis may not be comprehensive. So that's the point I want to make. VedaPulse itself has the ability to give multidimensional inputs about the human body, but it's important to realize that it's a tool, and that we need to use that tool in a proper manner. And these are the concepts that are actually very crucial, that will enable us to make better use of any tools that we may have. So, and that's the reason for giving all these explanations in this webinar. So I hope that point is clear. So the Ayurvedic approach is comprehensive and it gives equal importance to multiple parameters. And so we looked at constitution, then the pathological imbalance of the doshas, the quality of the tissues, and then the architecture of the body, how the organs are formed, and then also the quantification of body elements. And then it comes to certain other important aspects that we need to study about a patient before we complete our diagnostic assessment. And one of this is called a satmya or habituation. The different people have different habits. They are used to certain types of food, certain lifestyles, and the body has great capacity to adapt. That if a particular person is used to eating a certain type of food, even if that food is not generally considered to be very healthy, that particular individual have developed tolerance for that particular food or that particular way of living. And so this needs to be clearly distinguished. So it may not be advisable to completely radically change that person's food habits or all of a sudden change his lifestyle. We have to do that step by step, slowly. So changing lifestyle and diet should not be done drastically or very quickly. So this is the point that Ayurveda emphasizes. So when you diagnose a patient, we need to do a thorough study about his lifestyle, his diet habits, what they are used to, what they are not used to, so that we impose or bring about change in lifestyle and diet in a step-by-step manner. Then we need to also look at the mind of the individual. Crucial for counseling to be successful, we need to do some thought engineering of the patient's involvement in the treatment, the patient's level of self-confidence, awareness, the strength of the mind. All these things count in the way you will plan the treatment. So there are some people who are mentally very delicate, very weak. Even certain types of treatments may not be feasible for them. So we need to also, assess the mental constitution of the patient, and that's why that's also included. And then we have the capacity of digestion. What is the status of the digestive fire? How strong it is? What kind of diet you have to advise? What kind of medicines you can give? If all Ayurvedic medicines need to be digested before they are absorbed and they act on the body. So it's very important to assess the digestive capacity of the individual. And then the ability exercise tolerance. This is an index to the strength and overall efficiency of the person, just like we do the treadmill test today. This is done to study exercise tolerance, how an individual is able to tolerate exercise. And this also gives an index to the overall health of the person. And Ayurveda advises that one must exercise only up to half one's capacity. Stretching beyond half of one's full strength can cause stress and damage to the internal organs. So this is another assessment that needs to be done so that we include an appropriate plan of exercise for the patient. So the diet is customized, the exercise is customized, and an approach that is suitable to the mental temperament of the patient. And also, we don't bring radical changes in the person's diet or lifestyle habits so that there is no shock for the human body. And then finally, the age. We have to see what is the impact of aging. And this is not just the physical age, because we know that some individuals age slowly and some individuals age fast. So a person who is just in his middle age may already feel the impact of aging, may have degenerative diseases or difficulties, whereas a person who is more advanced in his physical age may actually be physiologically younger. And so this is really very, very crucial to assess before we decide what kind of treatment should be given. So this tenfold approach of diagnosis is extremely crucial. Yes, the exercise capacity is studied by looking at stamina. So in Ayurveda we say the time taken for sweat to be produced on the forehead, the time taken to produce gasping, that is fast breathing, respiration. So that is considered to be the limit that you shouldn't exercise beyond that. So this time taken for this will vary from individual to individual, and it will also vary uh, every day depending on the conditions, the climate, and also by practice this will change. So the stamina is the point where you're able to be active without, feeling tired, without being exhausted, without feeling stress on your respiration. And when the sweat begins to kind of manifest, that is a point we have to withdraw. So this varies from person to person. And today we can also use modern assessments like the treadmill to see how the heart rate is varying. We can look at the pulse and many other parameters also to understand whether the person's exercise is being done beyond his or her capacity. So we have a very comprehensive and interesting kind of approach in Ayurveda to bring about a personalized diagnosis. So you can realize this is much, much beyond simply diagnosing a disease. This is all about diagnosing and understanding an individual in terms of some of the critical parameters and then planning a treatment. So here is again another tenfold approach. Here we have to look at certain other parameters. There are many parameters which are the same as earlier, but there are some additional parameters that have been included here. One is the place where the person is living, and then the strength, the physical strength of the individual. And then we have a very important thing, avastha, which is called as the different phases of a disease. So here, the purpose of this tenfold approach is to decide or understand what is the strategy for treatment according to the imbalance of the doshas. So when you treat the dosha with a specific medicine, you have to make sure that the medicine that you are giving, even though it may target the dosha, it shouldn't harm the tissues. It should be suitable to that particular place. Like for example, in a very hot and hot place like a desert, certain medicines cannot be used because it can cause reactions from the body. You might use that medicine if the patient was living in another location. So certain medicines need that the body has enough strength to withstand them. So even if the medicine is good for the dosha, it may not be good for the strength of the patient. And also the time. Some medicines should not be used at night, some should not be used during the day, some substances should not be used at day or night, or their effects may change
depending on the time that they are used. And so here the time is necessary. And some medicines need good digestive ability of the patient. So even if the medicine is good, if the patient cannot digest it, you cannot give it. And some medicines are contrary to constitution. Some cannot be given in certain age. Some medicines cannot be given to children. Some medicines cannot be given to old age people. Some procedures cannot be performed on people whose mind is very weak. Procedures like MSS or bloodletting, it may not be possible to perform them on some patients who are mentally weak. And so these are all the different conditions that we need to examine before we decide what treatment is to be given. So this is what Ayurveda calls as holistic or balanced treatment. I hope this is clear. Okay, so we move forward. So there are 2 points in Ayurvedic diagnosis when we look at a patient. We are looking, I discussed earlier that we are looking at the patient on the one hand and the disease on the other hand. So our treatment is not just for the patient or just for the disease, but it is for both patient and disease. Similarly, there are 2 key points in diagnosis that we need to examine the lifespan of the patient and also the strength. And by strength, you can say the immunity of the patient. So the lifespan of the patient is done. There are many techniques mentioned in Ayurveda. So we look at the quality of the organs. It's basically prognosis. So when a patient has a particular illness, so we know whether that illness reduces the lifespan or not. Like for example, a patient who has a severe cardiac disease, we know that that person can live only for maybe so many years. So depending on the disease that a patient is affected with, we make an assessment of the lifespan. So if all the organs are still functional and there's no damage, then we can say that if we treat the disease, the patient is likely to live the complete lifespan. But if there are serious, irreversible damages that have happened to the internal organs, then we understand that the patient may not live for very long time. So the assessment of the lifespan depends on what type of disease the patient is affected with. So Ayurveda says that there are some diseases which cause immediate death and some diseases which cause delayed death, some diseases which do not really does not reduce lifespan. So 2 impacts of disease on the human being. That is, one is that it may be threatening, life-threatening. Life-threatening can be an immediate threat to life, or it can be a reduction in the lifespan. And then the second thing is the strength or immunity of the individual. A disease may not affect the lifespan, but it may affect the strength or productivity. It may interfere with the normal functioning of the human being. So even if the person is not going to die, he will not be able to function as normally as he would have. So this is why these 2 examinations are important. The examination of the lifespan and the examination of the strength. So will the patient be able to recover full lifespan? Will the patient be able to recover full strength after your treatment? So this is also important in diagnosis. So this is an overview of the Ayurvedic methods of clinical diagnosis. And as we it's multifaceted, it looks at multiple elements, and with there are some difficult approaches in Ayurvedic diagnostics, like pulse diagnosis, which is very subjective, tongue diagnosis, which is again very complicated. So devices like VedaPulse is promise in terms of making some of these subjective parameters Okay, can you hear me now? There was a brief interruption in the internet. Hello, can you hear me? Yes, yes. Okay. So I was just asking whether you have any questions at this point, because we are going to move to another important topic, which may also be a little bit complex, because this is AMA and how it is assessed in diagnosing diseases. If you have any questions regarding what we already discussed, then we could check that before we move forward. Okay, so I guess that there are no questions, so we move to the assessment of AMA. So I think you already heard about AMA. Is there anybody who never heard about AMA before this class? Anybody who did not hear at all about AMA before we started our class today? Okay. Okay. So, you know, AMA is normally sometimes translated as undigested food. So I would like to first of all emphasize that AMA is not just undigested food. AMA is actually improperly formed rasadhatu. It is the dhatu which has been improperly formed, the first dhatu after digestion of food. If it has not been formed properly, then it is called as rasadhatu. Is this clear? Okay. So AMA is, strictly speaking, something that the body cannot digest or eliminate. And this is from undigested food. Because undigested food can be digested if it is given time or the body is able to eliminate it. But AMA cannot be digested without some apart from food. So that's the difference between undigested food and AMA. Undigested food can be digested if the body is given time, or it gets eliminated by symptoms. acute indigestion is known by symptoms. Discomfort. And also difficulty in excretion. When food is not digested, the fecus is not properly formed. There is acidity, there will be gas, and there's heaviness, and all these problems are seen. So sometimes the symptoms are mild and we ignore it, but sometimes the symptoms are very severe and then we find it very difficult. So this is the key point, that ama is something which can be, which cannot be digested or removed, and there we need some help from outside. So I hope this point is clear. Now we will try to understand how we assess it. Okay, so we move on to the next point of how is ama produced. So ama is produced by the weakness of the digestive fire. It can happen in the stomach or in any part of the body, even at the level of the dhatus. In the body, substances are being continuously transformed. Substances are continuously transformed. So if there is a break in this transformation, and if a byproduct is produced which the body cannot transform further, or which the body cannot eliminate, then we say ama has been produced. So ama can be produced in this anywhere in the body. But indigestion can be a cause. Indigestion can be a cause for the formation of ama. So how does the body deal with ama? So you can see when ama is formed, the body tries to burn it. So what the body does is that it gives you signals, stop eating. You feel nausea, you feel some aversion to food, and it gives signals to stop furthering food. So when the body tries to burn ama, we get the first disease response, and this is fever. So we get fever or jwara, which is called in Ayurveda as the first disease, the first attempt of the body. So whenever there is ama in the system, the body will try to burn it. And actually nature also participates. The bacteria, and why they are the scavengers. So when there is some waste to be destroyed, so if there is ama in the body, it will attract bacteria. The function of bacteria and these microbes is actually to decompose the ama. So that is why when we have ama, we become susceptible to infection. So this is what Ayurveda says, that an infection can happen only if there is some ama already in the system. So ama will attract the microbes into the body. Just like if you have dirt around us, microbes will come to decompose it. So the function of the microbes is to decompose. So the microbes actually help us in eliminating the ama. So that is the disease process. And infection is a process through which the body now wages a war against the ama. And the microbes are participants. And if the body also participates, then we can eliminate the ama, and then the microbes will go their way and the disease will subside. So this is another way of looking at infection. We say it's not infection, but it's actually invitation to microbes. Yes. If we build ama in the body, then the body sends an invitation to microbes. So we get attacked by microbes. Now we get fever, and in that process the ama is destroyed. But if the ama cannot be burned, then the body tries to throw it out by bowels or mouth. So we can also get diarrhea and vomiting when there is too much of ama in the body. If the body is not able to burn it, if it is too risky to burn it within the body, then the body will try to throw it out. So we may get vomiting or diarrhea. So these are two simple methods through which the body deals with ama. So many diseases are actually just attempts of the body to either burn the ama or throw it out. So is this clear? And microbes may also participate in this process of burning the ama or even throwing it out of the body. Is this clear? This is a very, very important concept in Ayurveda. Now, also a third response, that if the body doesn't burn the ama, or if it doesn't try to throw it out of the body, then what the body does is to push it inside. Then the body actually pushes it inside into the dhatus. And then the dhatu becomes weak. Immediately, yes, it is now known that many antibiotics are not working anymore. There are superbugs which are resistant to antibiotics. Yes, in Ayurveda we try to remove ama. In modern medicine they kill the bacteria. But new bacteria comes. Old bacteria becomes resistant to antibiotics. So antibiotics are helpful if the infection is very severe. Then antibiotics are helpful. If the infection is not so very severe, then actually we don't need antibiotics. So I think if we use Ayurveda judiciously, we can avoid using antibiotics for a lot of diseases, a lot of conditions. So in mild infections, mild to moderate infections, when the patient has good strength, and if you're able to give good herbal medications, then we can definitely prevent use of antibiotics. But if the infection is very severe, and if there is no time to activate the body's defenses, then very careful use of antibiotics can be very life-saving. So I'm not against antibiotics, but only that we should use them very, very carefully. Okay, so this is, we'll go into more about ama. Now, you know, ama, if the body does not burn it or throw it out, then ama hides in the house. The body pushes it inside, keeps it inside, and it becomes inactive. And this kind of ama is known as lina ama. So there's a few Sanskrit terms here which I cannot avoid using. And when such ama is hiding in the body, then it causes, you know, the development of silent diseases. So ama hiding in the dhatus is known as lina ama. And people carry this ama for many, many years before one sudden day they develop an acute disease. So when there is ama in the body, which is not active, which is lying hidden in the dhatus, then the individual has loss of strength. The individual becomes susceptible to diseases, and they get, you know, heart attack, stroke, cancer, and all that. So heart attack actually has a long history. It takes a long, long time for the ama to build up in the body and produce heart attack or stroke or cancer. So hidden ama is actually even more dangerous. It is better to have a small infection or a small diarrhea or vomiting and throw the ama out immediately. If this is not done, then the ama remains in the body. And that is what eventually leads to blockage of the channels and damage to the organs, and then you get severe disease later on. Even cancer is caused by hidden ama that is remaining in the body for long periods. So that is why in Ayurveda we say that we have to do panchakarma once in a year or once in 2 years, because then all this hidden ama can be taken out and removed, and that helps us to prevent many illnesses in the future. So now if you look at hidden ama, this causes loss of strength, and when this hidden ama becomes active, but it is still inside the dhatus, it is called as alina. So in this stage, the disease becomes active. So in some diseases, the ama remains hidden for a long time, and one fine day, there is a sudden death or a sudden acute manifestation of the disease. In some diseases, the ama becomes lina and alina. It means it becomes hidden, inactive, and then suddenly it becomes active, and then again it becomes inactive. So such diseases happen in phases, episodes. Like bronchial asthma, for example, you have an attack of bronchial asthma, after which the patient becomes normal. And then after a few days, again there is another attack of bronchial asthma, and then the patient becomes normal. In a similar way, we have epilepsy. A patient gets epilepsy all of a sudden, and then after some days he becomes normal, and then again epilepsy comes again. So diseases in which ama hides and becomes active, hides and becomes active again and again, such diseases are happening because of ama, and these are called episodic illnesses. So we have silent diseases which kill all of a sudden, or we have diseases that happen in episodes like bronchial asthma and epilepsy. So this is how hidden ama. So the bottom line is that when ama develops, if you feel the initial signs, we have to take measures to remove it from the system then and there, and not allow it to stay inside the body. Because that is the basis for all serious illnesses. In fact, if we also suppress the ama by using some steroids or such other medications, then also the ama goes inside and hides inside the dhatus. And this can also cause future illnesses. So suppressing a fever, suppressing diarrhea, unless it is life-threatening, we shouldn't suppress any of these diseases. We must allow the disease to complete its course, and then the body removes all the unwanted substances and comes back complete and alive. So this is the principle of dealing with ama in Ayurveda. So we look at a few more concepts related to ama. Now we have what is called as visible ama. The visible ama is something which causes active disease. And the visible ama is localized in a particular place. And it is called as achala because it's localized, it's not moving, but it's continuously active. So a continuously active ama localized in a particular place causes chronic disease. Such diseases do not get cured because the ama is continuously active in the body. So diseases like rheumatoid arthritis, diseases like diabetes, these are all caused by this kind of visible chronic ama. The disease is always active and it is not possible to completely reverse it. So this is another aspect or understanding of ama. And then we have the active and mobile ama. When the visible ama becomes extremely active and mobile, it is called chala. Now it is fighting with the body. The body wants to throw it out and the ama wants to remain inside. So it moves everywhere and the body tries to eliminate it. And this is the stage in which you get acute severe disease. So active and mobile ama causes acute and severe disease. So just now we understood how silent diseases are produced by hidden ama, how acute diseases are produced by active and mobile ama, and how chronic diseases are produced by ama that is active but localized, and how episodic illnesses are produced. Episodic illness means disease that comes and goes, like epilepsy, seizures, and bronchial asthma, and things like that. And so ama is really at the basis of disease activity. So by understanding ama, we are able to understand the nature of disease and what type of treatment we need to really target. So there is no use of balancing the doshas if we don't first deal with ama. That is the importance of diagnosing ama. So our first focus has to be on how to handle and how to mobilize and how to remove or cook the ama. And after that only, if we specify the doshas, we are able to control the disease. So I hope this point is clear. Is everyone able to understand the concept of ama? I want to take a few moments to ask a few questions. Yes, please. Please let me know where you need more explanation and just to continue further. So here's a summary. When the body produces substances that cannot be removed or digested further, they interfere with the normal functions of the human body, and such substances are called as ama. When the body is unable to burn or remove the ama from the system, it remains hidden and inactive and may remain and build up in the body for many, many years, and one day it suddenly causes a disease. So hidden inactive ama causes silent disease. Is this clear? So I will explain the steps again. Ama is produced. Ama is something which the body cannot digest completely or eliminate. Is this point clear? When ama is produced, the body may try to burn it or to remove it. This is not possible physiologically. So we get disease. So body cannot burn or remove the ama without going through a disease process. So the best way to prevent or help our digestive system is to treat indigestion, to prevent indigestion. So if we take food according to our constitution, according to the season, and according to the place that we live in the right quantity, then we can prevent indigestion. And if we prevent indigestion, then we can prevent harm. And depending on what type of digestion we have, we can do activities, we can take medicines, we can adjust our diet so that our digestive fire is strong. And if our digestion and metabolism are strong, then ama will not be formed. So is this clear? So if ama is formed, then body cannot digest or remove it through normal physiological mechanisms. That is why when ama is there, we get disease. So disease itself is called as amaya, or that which is produced by ama. So disease is that which is created by ama. So if the body fails to burn it or remove it, then the ama remains inside the body and causes silent illness. And hidden and active ama, which keeps going inside and coming out periodically, this causes episodic illness. I told you already the example of bronchial asthma and epilepsy and such diseases which come as episodes. There will be one attack, and after that the patient is normal, and then after some time again comes another attack. Now visible and localized ama causes chronic disease. So when ama is localized and active, then it causes chronic disease. And when the ama is active and mobile, it causes acute disease. So this is how acute disease, chronic disease, episodic illness, or silent disease is produced. Out of these, diagnosis of silent disease is most challenging. Whereas the other three types of outcomes can be better understood. Ama is a very complex phenomenon. So you need to understand many chemical markers may represent ama. For example, we can be sure if ESR is raised, there is ama. Any inflammatory marker increase shows ama. If there is more of antihistamines in the blood, it means ama. So homocysteine, if it is present, then it indicates ama. So there are many markers. In different diseases, there are different markers which indicate that there is ama. So it's not so easy. We need to do more studies to fully understand how to objectively assess ama. So now we need to use clinical skills. So now we see how the ama behaves in chronic disease. In chronic disease, the ama is gradually digested by the body. But this leads to weakness of dhatu and imbalance of the doshas. So in the first phase of chronic disease, the dhatus are weak. The knowledge is very preliminary, still in research, so cannot be shared to the general practitioner. For example, we can say free radicals. If they get neutralized by antioxidants, this is one example given for how ama is cancelled. So there are certain substances, like for example, proteins join with glucose and produce glycated proteins. And these glycated proteins are actually causing micro vessel damage. So if you can eliminate the glycation, then it means we have digested the ama. If you can remove the glycation from the protein, then it cannot harm the micro blood vessels anymore. So that is what Ayurveda considers. In this way, when we neutralize harmful substances that accumulate in the body, then we say that the ama cannot harm the system anymore. So it also means certain antigen-antibody reactions. So macrophages actually swallow and digest these unwanted substances. There are substances in the body called lysosomes, which actually does this digestion of unwanted substances. So all this is, according to Ayurveda, digestion of the ama. Is this clear? Okay. So we will continue. So in the first phase of chronic disease, the dhatus become weak. And in the second phase of chronic disease, the dhatus become depleted. It means the dhatus are very much reduced and the body becomes weak. So now I would like to summarize the principles of diagnosis that we discussed today. The first step is that you must assess ama, and then you must assess dosha. So ama can be hidden, it can be visible, it can be active, or it can be inactive. And depending on this, we get chronic disease, acute disease, episodic illness, or silent disease. And then we have to assess dosha. I hope you remember the tables that we discussed today. 62 types of doshi combinations and plus 1, which is the normal. And then you assess the dhatu, whether the dhatus are weakened, in what stage of destruction the dhatus are. And based on these assessments, we can derive the principle of treatment. And how we are going to derive the principle of treatment is what we will discuss in our next webinar. But before we end today, we discussed today general diagnostic principles without referring to any specific disease. So in the remaining 20 to Yes, exactly. Even all the cells are digested during fasting, and the body is renewing itself. So fasting once in a while is also good for eliminating ama from the system. So this is the general diagnostic principles. And here we have not focused on any specific disease. So in the next 20 to 25 minutes that we have left, we will discuss about how these diagnostic concepts can be applied on basic diseases. So this is one part of our discussion over today. We'll go on to the next slide. So here we are going to look at the diagnostic principles in terms of the basic diseases. So now let us look at how these diagnostic concepts are applied in the context of specific diseases. So the substratum of diseases are the body and the mind. And an old textbook of Ayurveda called the Charaka Samhita gave us a template to understand how the basic diseases are created and how they manifest. So the body is considered as the substratum of disease. So in the body we have the inner zone, which is called as the koshta, the outer zone, which is called as the shakha, and the middle zone, which is called as the marga. And then the seven dhatus. So these we already discussed, the inner zone, the outer zone, in the beginning of our discussion today. So these three zones and the seven dhatus serve as the substratum for disease in the human body. And we can see which are the primary diseases that affect these zones in the body and the seven dhatus. That is what we will discuss now. Similarly, there is also mind as the substratum of disease. Rajas causes distortion in understanding, and tamas causes loss of consciousness. So I will like to discuss 8 basic diseases mentioned in an old textbook of Ayurveda called Charaka Samhita. So Charaka Samhita, have you heard of Charaka Samhita? Yes, it is one of the earliest textbooks of medicine. So Sushruta Samhita was surgery. And Charaka Samhita was medicine. So it belongs to the medical school of Ayurveda. And in this textbook, there is a framework given for understanding the pathology of diseases, which we will very briefly review today. And this text gives example of 8 diseases, which we will look at to apply the concepts that we studied today. So you can see in the body when the inner zone, or what we call as the alimentary canal and the related organs, which is called as koshta in Ayurveda, when this zone is affected by doshas, and especially when the rasa dhatu is affected, then we get jwara or fever. So whenever there is fever, we can know that the inner zone and the Rasa Dhatu is involved. That is when disease manifests as fever. When the inner zone or the Rakta Dhatu is affected, like if that fever becomes more established, if the fever doesn't resolve and the pathology continues, then the Rakta Dhatu is affected next. So from fever can come bleeding. So in many fevers which actually proceed from Rasa Dhatu to Rakta Dhatu, you can see that bleeding is a complication. We can see this in malaria, we can see this in typhoid, we can see this in dengue fever, and many fevers we can see that if the fever becomes really very severe, then in at a particular stage there is bleeding, and this can also lead to death. So this is the second stage of the disease. And so we have to prevent the fever from actually attacking the Rakta Dhatu, which can be life-threatening. And the third stage of development of the disease. So this is an important thing, that all diseases, it begins at the inner zone, it moves to the outer zone, and then to the middle or central zone where the vital organs are there. So if it moves to the central zone or the vital organs, then it can cause severe damage. It can affect the marmas. And so even a fever, if it is not properly managed, it can go to the central zone of the body, the middle zone, which consists of the brain. It can attack the brain and then cause damage. So we get brain fever, as they say. So, but normally, it's not easy if the body is very strong, and then if you're following a good lifestyle, then the fever is not able to reach into these interior zones, but it might still affect the dhatus. So it might first affect the Rasa Dhatu, and then it affects the Rakta Dhatu, and then it affects the Mamsa Dhatu. When it affects the Mamsa Dhatu, some tissues in your body may get damaged, and then this may lead to fibrosis of those particular organs, and this is called as gulma. So the inner zone gets affected by fever, where the body attempts to burn the ama, but instead of burning the ama, the body burns itself. It burns the Rakta Dhatu, causing bleeding, or it burns the Mamsa Dhatu, causing damage to that particular organ. So this is how fevers cause damage to the internal organs of the body, and especially fevers which are caused by imbalance of all the three doshas. They can be very severe and cause damage to other organs. Now, the fundamental diseases of the outer zone. The outer zone is the blood vessels and the channels, the srotasas of the human body. And here, two diseases manifest. One by the involvement of the Medo Dhatu. If any part of the body is damaged, then that part is replaced with fibrous tissue. Prolonged fevers but fever, I'm not talking about just prolonged fever, but fever transforming into other diseases. So in gulma, what happens is that the muscle becomes weak. So we have the outer zone. So is this clear? Is this clear? Did you get the answer? What I mentioned is not hyperthermia. There is a condition in Ayurveda called Rakta Pitta, which is translated as hemothermia. Is different. We have to do treatment for Pitta. Hypothermia is a complication of fever. Okay, so that is different. So next is the diseases. So the first three types of disease happens. These three diseases happen when the body tries to burn the arm. And the next two okay, so technically hypothermia means elevated core temperature of more than 38.5 degrees Celsius. And that is very dangerous for the body. Okay, so coming back to our discussion, I was talking about two categories of diseases. The first category is the diseases in which the body tries to burn away the armor. So fever, hemothermia, and this fibrosis, these are diseases that happen when the body tries to burn the armor. And instead of burning the armor, it hurts itself. Then we have the diseases of the outer zone in which the Medo Dhatu and Asthimajja Dhatus are affected. We get diabetes and skin disease. So here what happens is when the body tries to remove the ama through the urinary route, then it becomes diabetes. When the body tries to remove the ama through the skin, then skin diseases produce. So this is the Ayurvedic concept. So the body is trying to eliminate something, the excess glucose in the system, the excess kleda, or is being eliminated to the urinary route, or when it is eliminated through the skin, that is when the other two diseases are produced. So the first two diseases produced by body trying to burn the ama, and the next two diseases being produced when the body tries to throw out the ama through the urinary system or through the skin. Both the skin and urinary system are excretory organs. So in both these diseases, the Ayurvedic treatment is to bring the doshas back to the alimentary tract and remove from there. So in skin diseases, I will later show you some actual case studies with pictures of patients who have improved with skin disease. Also patients with diabetes. Yes, I will show later when we come to disease treatment, specific disease treatments. I will show some case studies, both skin disease as well as diabetes, where the use of Ayurvedic medicine to bring the doshas from the outer zone to the inner zone and then removing it from the body. That will be shown in our future webinars, because now we are discussing the principles of treatment, and later I will show you the actual examples. So I have patients of skin disease with very difficult psoriasis who have become better with our treatment, with our Vidyapeetham. Is this clear? Because now in this class it's too early to show the examples. We are still trying to understand the basic principles. And then we have, when the doshas affect the middle zone and the Shukra Dhatu, we have consumption, where the immunity is completely lost. So diseases like tuberculosis, AIDS, all these are produced when the middle zone and the Shukra Dhatu are affected. So these are the diseases of the middle zone. And then we come to diseases of the mind. When the mind is affected by Rajas, we get Unmada or psychosis. And when the mind is affected by Tamas, we get Apasmara or epilepsy. So this is what Ayurveda says is the basic mechanism of all diseases. And all other diseases are further complications of these fundamental 8 pathologies. So in a future discussion on more details of diseases, we will look into, examples, more examples. So at this point of time, I think this is enough for an introduction. So we can see here in the first stage, Jwara, Kapha is more dominant. In the next stage, Rakta Pitta, Pitta is more dominant. And in the stage of Gulma, Vata is dominant. So this is actually the process of evolution of disease. Disease starts with kapha dominance, it moves through pitta dominance and then becomes vata. So you can see in prameha or diabetes, these are tridosha diseases. The last three are tridosha diseases. The first three are single dosha diseases. So in prameha, it is tridosha but with more dominance of kapha. And kushta or skin disease is also tridosha but with more dominance of pitta. And shosha or consumption, the last disease, is also tridosha but with more dominance of vata. So this illustrates how we have to understand the doshic dominance and how specific dhatus are involved, and based on that we are able to derive a treatment plan. So this, how to derive a treatment plan, will be discussed in our next webinar with the help of actual case studies. We will show you, I will show you actual patients and their pictures and their data, and then we will see how these principles are actually used in clinical practice. So in fever, the body tries to burn the ama, and when the burning moves to Rakta Dhatu, then hemothermia results. When the burning destroys the flesh, then gulma results. So this is the response in the inner zone. So every time we have to understand the body is trying to heal itself. And sometimes it hurts itself or sometimes it heals itself. So as a physician, we have to understand what the body is trying to do and then accordingly help it to move in the right direction. So in prameha or diabetes, the body is trying to remove the accumulated waste through the urinary tract. So if the body tries to remove all this accumulated material through the urinary tract, then the kidneys will be damaged. That is why in diabetes we get diabetic nephropathy. So we have to help the body to move the waste from the kidney back into the alimentary tract so that the kidneys are protected. So we are able to prevent damage to kidneys by Ayurvedic treatment. Even if the diabetes doesn't get fully controlled, Ayurvedic treatment can prevent the kidney from being damaged, because Ayurvedic treatment helps the body to mobilize the excess doshas. Instead of pushing it out through the kidneys, the body is able to remove it through the inner zone. And in skin disease, the body is trying to remove the accumulated waste through the skin. So you can see in our next webinar with the example that when you bring all the doshas back to the alimentary tract, the skin becomes normal in no time. Within a few months, very severe skin lesions are eliminated just because we are able to bring the doshas back into the kosha. Whereas modern steroids, they only suppress the skin lesions. Once you stop the steroid, again, there is a manifestation. So in consumption, diseases like consumption, the body is struggling to preserve the strength of the dhatus. And so we need to enhance immunity. So this is the general principle of diagnosis and treatment. The treatment principles we will discuss in greater detail in our next webinar with the help of case studies. So in Ayurveda, line of treatment is decided on the basis of the therapeutic response from the body. And the treatment is decided on the basis of the therapeutic response. So diagnosis in Ayurveda means to understand what is the body trying to do. And with that understanding, we try to help the body. And so we will see how we can help the body with Ayurvedic treatments in our next webinar. So with that, we conclude our webinar today. If there are questions, we can take it, or else we will meet again next week.